Good morning. Throughout the global pandemic, our community has put forth a heroic effort. Educators are adapting to virtual methods of teaching and learning, completely changing how they do what they do. Families are doing their very best to support their children in distance learning. Students are doing their very best to stay engaged in distance learning. We have partners who have worked with us to stand up learning centers and provide supports to working families so that they have a safe place for children to go during distance learning. We have support professionals who are cleaning classrooms, preparing meals, distributing meals, providing transportation to thousands of children every day, providing meals to thousands of children every day, and transporting those. And we have Tulsans, so many of them, who are following the guidance from the health professionals and doing their best to keep themselves and their families safe, as well as to keep community spread from happening in Tulsa. This entire experience feels stressful, tumultuous, scary, and confusing, like a disaster, because it is. We are living, leading, teaching, and learning in a historic health disaster. It has upended lives, led to the loss of loved ones, and damaging of health, and the resulting economic crisis has caused its own set of challenges. Every day, I am so proud to work with and to have the amazing work and leadership of the team at Tulsa Public Schools and to have the leadership of the Tulsa Board of Education. To date, we have partnered with the Tulsa Health Department and the Oklahoma Caring Van to vaccinate nearly 500 of our school nurses, health assistants, and team members over the age of 65. And we're working to plan for additional staff vaccination clinics throughout February. 500 team members is a good start, but we have more than 5,000 who need access to the vaccine as well. We want to make sure that every person on our team gets vaccinated, particularly those with health risks and those who work with children with special needs. But that is not a decision that we are able to make at the district level. In about an hour, Governor Stitt will deliver his State of the State address. I and thousands of other families and teachers and support staff will be listening for one thing: that educators and education support professionals on the front lines across the state will actually be prioritized for the COVID-19 vaccine. Actions, not words. So, what have we done to prepare? We have improved our air filtration circulation systems in every building. This is key to having a safe environment. Every person in our family of Tulsa Public Schools has access to fresh air intake. We are providing masks to all of our staff and students, and we are the only district to provide proactive on-site rapid testing to adults and some students in our system as a way to minimize potential spread. Across the pandemic, we have remained grounded in science, in data, and research, which is evolving. The science is clear on a number of things. One is that COVID-19 disproportionately affects Black, Latino, and Native American communities. And the data is clear that Tulsa Public Schools predominantly serves students and families of color. So we take this very, very seriously. I made a promise in the spring, and it has been our North Star throughout this experience. No matter what political pressures No matter the uncertainties, we always lead with data and science, followed with the guidance of our health professionals, and we will make decisions based on that and based with that information on what is best for our children, our families, and our team. This commitment remains. Our level 3 and 4 special needs students began the year in person. In October, based on the advice of health professionals, the data and the science, I recommended to the board that we bring our students back to in-person learning in the second quarter. And indeed, we began doing that, and our youngest students came back to school in November. We are again now at a place with lowered and declining rates, substantial research about the ability to be safely in school, and with vaccinations underway for our most at-risk team members. That commitment makes today especially important because Tulsans, all of us, have wanted our students back to school in person for a long time. Based on our current COVID trajectory, and of course, subject to board approval, I believe that we can bring our students back to in-person learning before the end of February. We are now in the longest sustained decline in COVID rates since the pandemic began. Tulsans are doing their part, and their efforts are creating the conditions for our students to be able to come back in person. So I want to actually show you this. So this steep decline is the point at which the Tulsa Health Department recommended that we reverse our decision to bring our students back to school in person. That happened about right here. After about a month of very steady, very real increases. So what you'll see is a very steady, very real, meaningful decline in COVID cases where we are right now. Here. Now you'll see there's a bit of a blip from December 26th to December 31st. It's kind of a valley between those two peaks. And this is largely believed to be based on a decrease in testing and non-reporting. So this decline that's been happening is very meaningful, just like this massive increase was very meaningful. Now you can see that we are still at a fairly high rate of spread, but a number of things are different now. Treatments have improved. We have more and growing research about the kind of conditions we need to have in place to have our students in school in person, which we have had throughout this fall. And so the combination of that with this decline, which we believe will continue, and we're imploring upon people to help us continue it, that we can keep our schools as safe as possible and make us feel very excited about the possibility of a return to in-person learning in February. A few other announcements. One is that I'm going to be recommending to the Board of Education that we replace our April intersession with in-person learning. This will give us more time with our students in person and support their needs. In the meantime, we're going to continue with some things that I think are very important for Tulsa to know are in place right now. One is that we have out-of-school time partnerships, support for working families, where children can go in small groups, cohorts, which is what the research tells us is safe, for them to be in places led by the Opportunity Project in Tulsa. And this includes the Bike Club, Youth at Heart, Tulsa Debate League, the YMCA, the Zone, Tulsa Dream Center, Touch Tulsa, the Boys and Girls Club, and Tulsa Parks and Recreation. So I have recently been telling many families who've said, my child needs interaction, we need support with distance learning, I have work, my job, and so forth. Make sure, it would be very helpful for you to help us make sure that they know that there are places that their children can go right now. These provide safe and meaningful opportunities for students. In addition, every single one of our schools are open. They have been open, and they are open. And now every single one of our students, every single one of our schools right now has Care and Connect hours available for our students. This is for every student in the district. Another announcement that is very important. We will provide expanded summer learning opportunities for our students across June and July, and we will invest some of the recovery money that has been provided to our students' learning and enrichment in the summer. Every student who would like to access that. That's very important. Every student in our district who would like to access, needs to access these opportunities in the summer to support their learning will have access to that. This summer is going to be a critical time for our young people, for our families, for our city. Every year, summer provides a time for us to have flexible learning opportunities for students, fun summer camps, and so forth. This is a chance for students to get reconnected, to have fun, to have challenging projects, to have wellness support, to play sports, to create art, and catching up academically to prepare them for the upcoming school year. So we have a call to action, a couple of them today for Tulsa. We want to get our students back to in-person learning, and we want to keep them there. We want to keep them in their school buildings. That's where they need to be, we know that, and we all have to play a part in that. The first is the easiest. We just have to keep following the guidance, the safety guidance. We are so close to seeing our way out of this experience, but now is not a time to let our guard down just because we've grown weary. And we all have grown weary. We have to monitor our health if we have any symptoms. People say, I believe it's just allergies. Oh, it's just a cold. Any of those symptoms need to be a time for them to reach out to their health provider and to get tested. Keep your mask with you and wear it at all times. The efforts that Tulsans have shown have made a difference. They have helped us get to this point where we could have the potential for the return to in-person learning. And it will make a difference after that to help us to stay in school in person. So here's another really important point. The two things that have put us in the position that we are in are this dramatically rising data about the cases in our community and staffing. Staffing for schools right now is incredibly stressed. And that is even more true for Tulsa and other urban districts across the country. People say, why is Tulsa different? Well, there are lots of reasons, but one of them is the stress of staffing is more profound for us. It's also more profound for us because we have very small schools. And in our small schools, we have less of an ability to have additional adults to help cover classes when people are out, quarantined and so forth, and when there are vacancies and so forth. So we have faced, it is not new that we have a substitute teacher shortage. We urgently now, we have about a quarter of the substitutes that we have on a normal year. It's harder right now, but more and more people are getting the vaccine, and we have a lot of retired people who help us with substitute teaching. So we really want to encourage more and more people, parents and families, all of us to rise up together to be a part of this work. We will be increasing our daily rate for substitute teachers, again, using some of the recovery money that we've been provided. People can sign up to substitute teach at tulsaschools.org/substitute or by calling 918-746-6310. Also, we need everyone to get vaccinated as soon as they can. Everyone in our community. That will help us to keep the cases down. If you are a citizen of a First Nation, whether it's Cherokee, Muskogee Creek, Choctaw, Osage, contact your tribe. Through tribal health, our First Nations are doing an amazing job with vaccines right now. Some of them are into their third tier, and they're vaccinating anyone over the age of 40. So everyone who is a citizen of a First Nation, please contact tribal health and see what you might be eligible for. If you're a veteran, you may be eligible for a vaccine through the Veterans Administration. And of course, everyone should register with the Oklahoma Health Department at their portal at vaccinate.oklahoma.gov. And finally, but again, I'll repeat, it's so important, our state leaders need to actually prioritize educators and support professionals for the COVID-19 vaccine. Sorry. We have the ability in our system to vaccinate at least 30 staff members per hour. This could mean that we could vaccinate all of our school-based people in just a couple of weeks, maybe 3. If we started tomorrow, we could finish the first round of shots before the end of the month. Here's who has been vaccinated in Oklahoma as a priority. All of the state legislators who wanted it have been prioritized. Public lawyers have been prioritized, but not public teachers. We need this. Our children need this. We need to be back in person, and we need to be able to stay there. The vaccinations help for so many reasons, but one of the things they help with in schools is the kind of in and out that you see in districts across the state happens because of quarantining and staffing. When people have the vaccine, if they're exposed, they do not have to quarantine. So asking for vaccines for educators is not just about Tulsa. It is about all of Oklahoma. It's about not just keeping our team members safe, which of course it is, but it's also about keeping our students in school, all of them across the state. We know now more than ever before how important public school is to our community, to our society, to families, to our economy, and obviously to children and their academic and social and emotional health. So let's get our children back to our classrooms with their students, with their peers, and let's do everything that we need to do to keep them there. And I'm certainly available along with my team to answer any questions that you might have.
What will that first day look like for students when they come back?
Well, the first day, so when that first day happens will be something that the Board of Education will decide. We'll be talking more about that tonight, but there's not an action on the agenda tonight. So when that happens, the board will decide that at a future meeting. They could have a special meeting at any time. They also have a meeting scheduled for before the end of the month. It will, so let me just one moment. So what it will look like is that we hope to bring all of our students back, not in a half-time schedule, but in a full schedule. That's what we believe is possible based on the current knowledge that we have about the vaccine and schools, and based on the current trajectory of cases. Of course, we're going to continue watching this very closely. It will look like masks being worn by everyone consistently. It will look like all the safety practices that we have in place in our schools, that we have had in place for months now, will be followed very, very carefully. We have PPE, hand washing stations, hand sanitizer. We have our electrostatic sprayers. We have I'm sure I'm missing some, Jorge's back there. So many things that we're doing. Our ventilation, which I mentioned during my talk earlier, that ventilation is so important. So it's going to look like school with those conditions in place. It will also, we have more outside time for children and breaks that will give them both fresh air and a chance to have a break from mask wearing. Sorry, sir.
Yeah, I would like to ask you if there will be any other change, because you said the end of this month will be the kids will go to the school. Is there a possibility to change again? the date. The other question is if the kids will be allowed to get the vaccine.
So the first part of your question is that the decision about when children return to school in person is up to the Board of Education. And we will discuss it tonight. We will see what kind of feedback the Board of Education has, what their conversation is about the date, about when they want to make that decision, and so forth. So that is what we'll do this evening at the board meeting. The second part of your question is that right now, children under the age of 16 are not allowed to get the vaccine, and even students over 16 who are in our schools are going to be far down on the priority list from the state and the federal government, so they probably will not be vaccinated within this school year. So that right now we're focused on our adults.
Was this recommendation floated past TCTA or AMT?
Yes.
What kind of feedback did they give you?
There, we have, one of the things that was very disappointing to me is the disparaging remarks about our teachers union and our support employee union. We have the most amazing professionals who are represented by incredible advocates, but all of us are dedicated to children. So that I will not tolerate. What they want is for children to be back in person. We all want that. They also want and are advocating to make sure that their team members are safe as possible. So what we have shared with them is what we're sharing with you. We're sharing our confidence. We're reinforcing to them that this decision is not about public pressure. I think that's, because there's public pressure, people think that we're reacting to that public pressure. Quite the opposite. We are staying grounded in what I said in my comments is our North Star, which throughout this experience we have followed the science, the data, the public health professionals this entire time.
How difficult was it for you to come to this decision with so much controversy and so much discussion about it?
Well, I think that it is this, obviously, the whole experience for everyone, for different reasons, has been excruciating. As I said in my comments, this is a natural disaster. We are experiencing a disaster, so it feels like a disaster. When you're in a disaster, you have to stay focused. So as a leader, my commitment is to listening to our families, listening to their pain, their frustration, and their fears. And that is true, and our team, and that is true both for those who desperately believe we should be back and those who desperately believe that we should not be back. We have to listen to what they're sharing, and we have to respond. But we also have to stay grounded on what we are using to make our decisions. And that's what this team and I have been doing. And the board has very much followed that. They are extremely informed. Each of them take tremendous amounts of time to read the research studies themselves, to ask very good questions. And if we knew then what we knew now, we would do things differently in a lot of ways. But I feel confident that I can say that throughout this experience, we have followed that North Star.
Now, is your recommendation, if I'm hearing correctly, for pre-K through high school to go back all at the same time?
Well, I would say that right now there's not a specific recommendation, but I believe that we can get, based on this, what I've shared, that we can get all of our students back to school in person. And what our teams are preparing for right now is a fully in person, not a hybrid schedule. Did that answer your question?
Yeah, so that's not your recommendation?
Is what not my
That's
recommendation?
not you're not recommending that? Or are you recommending that?
I do not have a specific recommendation right now. I am sharing with you what I believe we're going to be able to do. This is the board's decision, so I want to make sure that I'm sharing that. We're discussing it tonight. We get feedback from them, and then we decide what we're going to do from there.
What about the parents that may not be comfortable with their kids going back yet?
Absolutely. We have a commitment to continuing to provide the distance learning opportunity for families who choose it. And it's actually helpful when people choose to stay in distance because it means fewer people in the buildings.
So some families, they are disappointed with they are not going, kids, they are not going to the school. And also, they believe there's a concern about the quality of education the kids are receiving online. What do you think about that?
Well, I completely agree with it. I think we all recognize now more than ever before how valuable public schools are in person. That we need, for the vast majority of our students, the best place for them to learn is in person with their teachers and their classmates, where they can play and experiment and discuss and engage. And that's what we all want. So I share that concern that you're describing from families. We all share it, and we've all wanted our children to be back in person. We just have to manage the safety situation. I would also say that we have made improvements to distance learning throughout this experience based on the feedback that we have gotten. And so we've continued to improve that experience, including the things that I described about the fact that our families have places their children can go right now to safely be in person for support. The fact that all of our schools are open for Care and Connect, and the fact that we have a commitment to doing what we need to do over the summer and moving into next year to help all of our students catch up academically and get that socialization support that we know that we're all going to need to recover from this experience. Okay, thank you. We will have further discussion about it tonight in the board meeting. Thank you for coming.